Good morning, friends of the media. Thank you for coming to this media briefing. The Chief Executive will say a few words and then she'll take questions from you. Now I'll invite the Chief Executive to speak. Friends of the media, members of the public, good morning. Now, around the world, there are now more than 700,000 cases of confirmed COVID-19 infections. So that's an increase of one time 100% in the past week. And unfortunately, the same speed of infections also happened in Hong Kong. Now, in 4 days, cases increased from 300 to 600. Yesterday, the number of confirmed cases was 683. For all these new confirmed cases, they are imported cases of residents coming back from overseas. And of course, these residents were in places severely affected by the disease, in particular the UK. Today, we have some 2,000 to 3,000 arrivals at the Hong Kong International Airport. Now, we have already banned the entry of non-Hong Kong residents. So for the majority of people coming back to Hong Kong, they are Hong Kong residents, except a handful. Indeed, there's just a handful of non-Hong Kong residents who have been given exemptions. For example, Macau residents for whom there's a special arrangement. So as soon as they arrive at Hong Kong, the Macau government will arrange for them to go back to Macau at once. And also there are also exempted people like the cruise, the flight crews. Now, with this large number of new cases, that's added immense pressure to the work of the government. We have Port Health Division colleagues carrying out quarantine at the Port Health points, and also there are many people who have to carry out tests. At the same time, of course, at the hospital authority, there are many healthcare workers helping to treat and take care of the patients. And then there are many others in doing logistics, which whom you might not see. For example, the Center for Health Protection is responsible for tracing the close contacts of confirmed cases. And then there are a large number of colleagues at laboratories doing tests. There are also others manning hotlines to answer questions. And then there are people being home quarantined, and the Home Affairs Department and the Social Welfare Department have many colleagues providing support to the confinees. And of course, there are colleagues too doing data analysis. And then the Steering Committee and Command Center have many colleagues too working to respond in a timely manner to the evolving epidemic. Now, these are our heroes. They've been working hard for 3 months. Some you see them every day, without a break. They're working every day, and this is no time to let down our guard. But then what is adding to our burden is law enforcement work. Now, if no one breaks the law, there is no need for us to enforce law. The reality is there is still much law enforcement to be carried out. So that's why I'm going to spend a few minutes today to give you an account on the law enforcement work in relation to the three new regulations under the Prevention and Control Ordinance. The first one is CAP 599E. We have already issued over 50,000 quarantine orders. That is for people coming back to Hong Kong through the Hong Kong International Airport. They have to be put under these quarantine orders. But then we found many people breaching the quarantine order under CAP 599F. I must stress again here that the SA government is adopting a zero-tolerance attitude towards people who breach the quarantine orders. Now, if any person breaches the quarantine order from that moment on, that is when they leave their homes, we will be pursuing them with full force, and then we'll send them to closed quarantine centers. We'll also take up prosecution. Now, we have some figures, but the figures changing every day. Now, yesterday the court made rulings, but the Secretary for Security told me there are 5 other under home quarantine who've also broken the law. So far, there are some 70+ people who've breached the quarantine orders. They've been sent to the quarantine centers, and then we'll be applying for we'll be applying to the court to prosecute these people. Now, of course, if they break the law, there will be consequences. Yesterday, the court made rulings on 3 cases, not under Cap 599E, but rather Cap 599C. That is for people coming back from mainland. They also have to be subjected to home quarantine. We treat them all equally. And then the court made rulings yesterday. All 3 defendants were sent to jail at once. The longest term of imprisonment was 3 months with a criminal record. So, for people subjected to home quarantine, please think carefully. Is it really worth it? Because you just want to go out, and then your career, your education, and your future may be affected. Do you want that? And then the second legislation we have to enforce is the Cap 599E on food premises. This came into force at 6 p.m. on the 28th of March. And then there are the Food and Environmental Hygiene Department, Home Affairs Department, and so on are the licensed authorities. They have been doing inspections and given out warnings. So far, the situation is satisfactory. I'm sure you've taken photos of restaurants. Then that no more than 4 customers are at each table, and tables are spread apart. And then for premises that have to be closed, like gyms and cinemas, they've been closed. So I hope all premises operators will continue to observe the regulation in the coming 14-day period. And then our departments will continue to be doing inspections. And then there's another piece of regulation that we have to enforce. That is Cap 599G. It came into force at midnight on Sunday. That is to ban gatherings of more than 4 persons. The police is responsible for enforcement. The police has already been stepping up patrolling. The police have been giving verbal advice and warnings, but then we won't rule out that we might give out a fixed penalty of $2,000 without warning in future. For Cap 599F and 599G, the validity period is 14 days. It's been 3 days since, so I hope all those affected will remain self-disciplined, so we could see this through together. Now, if people would abide by the law, we don't need a large number of officers enforcing the law, and there won't be any need for conflicts during law enforcement. Of course, the government will do its part in public education and publicity, and then through employers groups and through consulates general, we will make appeals to the relevant groups so that the people will avoid gatherings of more than 4 persons in public places. And in law enforcement, I must also thank the people of Hong Kong. They are doing their civic duties to report people who've breached the orders. But more importantly, if you have friends or family members under home quarantine, please advise them to stay home. They must not breach the quarantine orders. Here, I would also like to thank all the food premises and all affected trades for their full cooperation. As I mentioned, this series of harsh measures, I promised that the SAR government would launch a second round of anti-epidemic fund. And we will be spending another tens of billions of dollars to help industries hardest hit. And also will provide help to their employees in this industry. We will press ahead with this task with full speed. In fact, we have already started meeting stakeholders. Now, I must say that this crisis facing us is unprecedented. And you will learn from the publication of the February retail figures how hard Hong Kong has been hit. So for the retail and catering industries, they face immense difficulties and fully understand that. So we will be responding suitably to that. And I hope I will be able to make that response soon so they could rest assured, and then there will be no need to dismiss employees. Now, for catering and retail industry, one of the major cost item is rentals. I've met with REDA recently, that is a Real Estate Developers Association. I hope they will consider reducing rent for their tenants during this difficult time. And understand in February and March, some shop or store or shop owners or property owners have actually reduced rent for their tenants, and I will appeal more to do the same. And then for government departments renting out commercial premises and shops, I will ask them to review the rent level as well. So now the floor is open to questions.
後排各位男記者。
The gentleman over there in the last row. I'm from Now TV. It's been said that there will be more quarantine centers to be set up. What is your target numbers? And it said that for some cases, confirmed cases, they have to wait for more than a day. In some other cases, up to 4 days of waiting is required before they are sent to hospitals. And also, do you think that the ban on big gatherings of crowds has been effective, especially when Qingming Festival is coming up? We have more surge of confirmed cases. As I've said, it's about the chain of our operations, and we are facing a lot of pressure in resources. Because when we talk about resources, whether they are quarantine centers or isolated wards and beds in HA, they are limited in numbers. So with limited resources, we have to work hard to increase the level of supply. We are working on a few items to increase the number of quarantine places. For example, the Pak Hang Police JPC Center and the Lei Yimun, another phase of facilities in Lei Yimun, and also in Cheung Kwan O, we're going to use a modular, in Panic Bay, we're going to use a modular housing to provide more facilities. And HA is working hard on increasing the number of negative pressure beds by 400, and at the same time, HA and D of H would need to share resources or co-use facilities to face the challenge. I can only say today that I won't rule out that the HA would, in respect of patients who are about to fully recovered, to send to an alternative isolation facility. And we have a quarantine center being considered, which is under the Center for Health Protection. We haven't worked out the details yet. This is about the co-using of the sharing of facilities. When two agencies are using the same facility, we need a high-level steering and coordination. As for the cases that you refer to, well, they are not ideal. Usually, when a case is confirmed, usually the patient is already in the hospital. And if the test turns to be positive, the patient will be sent to an isolation ward or bed. So it's not ideal that a confirmed case remain outside our hospitals. But since we are facing a challenging situation here, well, it's just that we cannot avoid such problems altogether. I've asked the there's the Director of Health to work out something with the HA. And if the test resulting from the diphtheral saliva sample is positive, then we have to streamline the procedure for the confirmed patient to be sent to hospital for treatment. On another point, and that is after the introduction of 599G to prohibit crowds of more than four people, I already said that a lot of self-discipline will be required on the part of our people. We are seeing a lot of a high level of self-discipline, apart from some isolated cases. So I do believe the regulation has worked well. It's not because of the penalty or the fine that may result from a breach. It's just that people are doing their part by staying at home and avoid going out to have meals in order to collectively control the spread of the virus. We are going to be very flexible in our reaction. We'll see what more can be done, including what more restrictions might be rolled out in respect of the coming festival. On the left-hand side, the gentleman.
Hospitals are now running out of isolation beds, and there are even patients saying that they have to wait for days to get admitted to hospitals. So what are you going to do about this? And secondly, given that there are now so few cases on the mainland, is it still necessary for Hong Kong to require people coming from the mainland to self-isolate? Do you have any plans to reopen some of the border checkpoints anytime soon?
Well, first of all, as I have admitted just now, it is not satisfactory for confirmed cases not to be admitted into hospital yet. But this phenomenon appears because we have a large number of arrivals from overseas who have been put on home quarantine, which means that they, upon arrival, they have no symptoms. So they have been put on home quarantine. But in order to play safe, we require each of them to go through a saliva test. So as and when the saliva test is confirmed positive, then this patient becomes a confirmed case. But he or she is still staying at home. So there needs to be a process to arrange for this confirmed positive patient to be admitted into hospital. And the problem now lies in that capacity constraint in the hospital to admit patients in a more speedy manner. I have asked the Secretary for Food and Health to work very closely with the hospital authority to speed up the process as much as possible. I suspect the addition of the 400 second-tier isolation beds very soon in the hospital authority will help to provide more capacity to handle the situation. Now, as far as the situation in the mainland, you are absolutely right. The cases in the mainland have dropped to a very, very low level. And actually, I suppose the great majority of these confirmed cases in the mainland recently are imported cases. So logically, especially given our constraints in managing the home quarantine cases and so on, there may be some justification for relaxing some of the control requirements. But my reply is no. For the time being, we have no plans to loosen any of the controls being put on arrivals from mainland. One is the situation is very fluid. It may still change. Secondly is after all these control measures, closure of border control points, imposition of the 14-day quarantine, not only with the mainland but also now with Macau, we are seeing a significant drop in a number of arrivals, whether they are Hong Kong residents or non-Hong Kong residents, coming in from the Hong Kong-Zhuhai Macau Bridge, as well as the Shenzhen Wan Bay control point. So there isn't a huge need for relaxing the border control points. And thirdly is the regulation applicable to mainland arrivals, which is Regulation 599C, will expire. You remember all these regulations are time limited. This particular one will expire in early May. So even if we do nothing, by early May, this regulation will lose its effectiveness, and then we will be able to resume some of the traffic flow without this 14-day quarantine requirement.
答得最後一位，左手邊近中間呢位記者。
Last question. Good morning, Mrs. Lam. You described the frontline healthcare workers as heroes fighting the epidemic. Many healthcare workers started a strike demanding a border closure. So would you still pursue them because of their position? And then individual members of the pro-establishment camp and also Yao Geping, former Basic Law Committee, urged you to legislate for Article 23. Do you have any plan or time frame to complete the legislative exercise within your term? And then finally, the Ministry of Foreign Affairs have demanded journalists of free foreign press agencies to return their journalist cards so they could no longer cover stories in Hong Kong. So would the Hong Kong not approve visas for these people to carry out journalism in Hong Kong, if that's the case? Now, everyone's focus is now on fighting the epidemic, so I hope we all take very seriously the work to fight the epidemic. You might have noticed that I describe people as heroes fighting the epidemic, and that included all frontline staffs and also those in back-end offices, because I must also commend the work of those who are working away from the limelight. Of course, for frontline healthcare workers, they're the first to bear the brunt. They have a heavy workload. We're also very concerned about whether there is a sufficient supply of personal protective equipment for them. So here we're talking about tens of thousands of people, civil servants and members of the public taking part in this fight against the pandemic. I just want to recognize their effort. Basic law is a constitutional document that ensures the stability and prosperity of Hong Kong. And in fact, in a few days, it will be the 30th anniversary of the promulgation of the Basic Law. But unfortunately, because of the epidemic, exhibitions and other publicity and promotion campaigns have to be postponed. Now, so this is the 30th anniversary of the promulgation of Basic Law, and the Hong Kong state government has been established for 22 years now. And then we're talking about a provision that ensures national safety, and we have not yet legislated for it. But then, as I said, now our focus is squarely on fighting the epidemic. Your third question, well, is straightforward. Every entry case is an individual case. We act in accordance with the law. We also go by our immigration policy. If there is any application under the relevant immigration legislation, we'll know if the application will be approved or not. I cannot foresee the results of any application at this point. Thank you.